Hi, good morning. I hope you can all hear me okay. My name is Sorcha McPhillips and I'm the Chief Executive of the Huntington's Disease Association Northern Ireland. You'll have to bear with us when we use technology for these training sessions. We have a few people maybe will join late, so I will just be letting them in as we go. You'll note that your videos are active, but your microphone should be muted throughout this session, and that's just to avoid any distractions for our speakers. If you have any questions at all, you have an option at the bottom where there's a chat function. You can type your questions at any stage and then I will just review them at the end with Siobhan, okay? If there's any issues at all, please just use the chat function and I'll respond. So we're going to be recording this session to allow other people who weren't able to attend to view it at a later point. And I'm going to introduce now Siobhan Harding-Lester, who's a genetics counsellor with the Regional Genetics Service in Northern Ireland. Siobhan's going to speak to you for a few minutes and then we're going to go over some questions. Okay, Siobhan, are you ready to kick off there?
Yes, yeah, I'm ready, yeah. So as Sorcha said, I'm Siobhan and I work at the genetics department and based in the City Hospital. And I'm going to talk to you today a wee bit about what options are available for families with a history of Huntington's disease regarding sort of starting their own family. So of course you can have your children naturally like anybody else. And this is very well aware that Huntington's generally doesn't start until sort of middle age, though in some families it's earlier and others it's later. So there are plenty of families that choose not to do anything during a pregnancy because they're hopeful that there'll be some sort of a treatment by the time that their children are approaching the age when they would be showing signs. For other families, they may wish to get pregnant naturally and do testing during a pregnancy. Now, in Northern Ireland, this may be a little bit tricky. I've actually had a family try to request testing during pregnancy, so I don't know exactly what the outcome would be and if our obstetricians would do it, because the reason why they may not do it is that everybody has a right to choose when they wish to know if they're going to develop Huntington's disease, and for everybody their timing is different and some may choose never to know. So if you were to test during a pregnancy, you would be taking away your child's right not to know. But some people do it, particularly over the water, because they may wish to terminate a pregnancy based on the results. And I know I've heard anecdotally in England that this has happened, but in Northern Ireland, the pregnancy laws have recently changed and you can only terminate at the moment if there's a serious risk to the fetus, sort of dying quite early on in childhood, which obviously doesn't apply with Huntington's disease. The other reasons for testing would be serious, for terminations would be serious risk to the mother's mental health or physical health. So for Huntington's, it would be on those grounds that you would be requesting a termination. But of course, you'd need to discuss, if you were thinking of doing that, it's best to discuss that with an obstetrician. As I said, I've not really had a family go through that, so I don't know for sure if they would do testing in a pregnancy and then termination based on the result. Other people may choose to use donor sperm or donor egg, depending on which parent is at risk of Huntington's. But the thing that most people are, or when they come to genetics, are interested in is knowing about PGD, which is pre-implantation genetic diagnosis. So what this is, it's basically a form of IVF. It's a specialized form of IVF. So the child is biologically yours, and they will use the partner's eggs and sperm and fertilize the embryo. However, how it is different from standard IVF is that they would then test the embryo and only implant embryos that do not have Huntington's disease. This is quite a complicated procedure and is not done in Northern Ireland. At the moment, we are using Guy's Hospital in London for this. And so all our couples that choose PGD would go to Guy's in London. It is available on the NHS. You don't have to pay for it. But there's a lot to think about before going down that route. You need to think about what you would do if you have more embryos than children you would wish. So say you had 5 healthy embryos, but you only wanted 2 children. You'd have to think about what you're going to do with the other embryos. You also need to think about what would happen if you and your partner split up. So who would own the embryos? Who would have rights to the embryo? Any embryos that have the Huntington's disease gene would be left to perish. So if you have sort of an ethical problem with destruction of a potential life, then PGD is not for you. It doesn't always work for everybody. Out of the couples that start the process, only about a third will get a baby at the end of it. And that's because there's a lot of sort of pitfalls to go along the way. First of all, you would need to be given lots of, the female partner would be given injections to make her make lots of eggs. Some women do not react to this, so don't make very many eggs. Other women become quite ill and the process has to stop. Once you've got the number of eggs, these are then fertilized using the partner's sperm, but of course not all the eggs will fertilize, so the numbers available have gone down. They would then test the embryos, and of course some of them may well have Huntington's disease and so would not be used, and you could be in an unlucky situation in that all of them have it, so you'd have to be back to square one again. Of the embryos, once the embryos have been tested, not all the embryos will be healthy and will survive until the process of implantation. So again, your numbers may have gone down. Once the embryos have been tested and if they look healthy, then they would implant 1 embryo. But just because they implant the embryo does not mean you will become pregnant. So it's a very, very stressful process to go through because there is quite a lot of steps and you're very anxiously waiting for results of each one of these. And added into all of that is the complication that you have to go to England for it. There's probably about 5 or 6 appointments that you would need. Not all of them you may not have to go to Guy's Hospital for every single one of them. You probably need to discuss that with Guy's about what can be done locally and what can be done in Guy's. We don't currently have an agreement with any local groups. So it's the Regional Fertility Centre in Belfast. We don't currently have an agreement with them, between them and Guy's Hospital, but we are working on that. So hopefully in the near future, the process should be a lot more smooth and it should be easy to get scans and things done here in Northern Ireland and just go over to Guy's for the appointments that are essential and need to be at the specialist centre in Guy's for it. I am aware of some couples that have gone to the Regional Fertility Centre for a few scans and they just end up billing Guy's, but it can be a bit complicated. But like I said, hopefully things will be smoother and you won't have to go for all of your appointments, but you will still have to go for the majority to Guy's Hospital. Once you become pregnant, then your pregnancy is just a normal pregnancy like anybody else, and you're treated here in Northern Ireland and you give birth in Northern Ireland and don't need to go back to Guy's. Now, to get PGD, there are some caveats because it's not available for everybody, even though it is on the NHS for some. So the Northern Ireland Health Board does not have its own rules on who can and cannot get PGD. So when we make applications, we have to say if you meet the English guidelines or not. If you already have one child that you know does not have Huntington's disease, then you do not meet the English guidelines, and we have to say that on the application form. However, sometimes Northern Ireland will still grant funding for PGD even if you don't meet the English guidelines. You have to, and Guy's Hospital themselves have some rules, and these apply to everybody. So Guy's won't do PGD if the female partner is 40 years old or above, and that is because they've never had a successful pregnancy in a woman over the age of 39. So you do need to be in your 30s or younger before you can apply for PGD on the NHS. You also have to have a healthy weight. So you have to have a BMI of above 18 and below 30. And the reason for this is that if you are too thin or too overweight, then this reduces your fertility. And although it's difficult to control weight, it is something that is within your control, although I do recognize it's very hard. So you would need to make sure that you're of a healthy BMI before the females is of a healthy BMI before applying. And also, neither partner can smoke and has to have stopped smoking for at least 6 months. And again, the reason for this is smoking reduces your fertility. And so if they're doing this procedure, which is very expensive and time consuming, they want to make sure they have a maximum chance of you becoming pregnant. So you'd have to have stopped smoking for at least 6 months for both partners. And they also have, whenever guys do this, they have to take the welfare of the child into account. And for that reason, couples have to have been living together for at least a year in order to apply as well. So those are some rules that Guy's Hospital have before proceeding. Another thing that the health board will consider is how many cycles of PGD you've had. So in England, you can't have funding if you've had 3 cycles already. Again, Northern Ireland will consider it, but there's no guarantee. If you are not able to get funding through the NHS, paying privately is an option. I'm not aware of anybody from Northern Ireland that has paid privately. It's very expensive. I think it's around 10,000, but I don't know the exact figure. It's a lot of money. If you are paying privately, you would need to, I would ask the institution that you're using about what their rate is of having a successful pregnancy, so based on your own personal circumstances, because it's a lot of money to spend. So we want to make sure that you have a good chance of becoming pregnant. And it is also that refers people for PGD. So if this PGD is something that you are interested in, then you should get yourself referred to the genetics department, and we can talk to you about PGD. And then if you meet all the criteria, we can request funding for you from the health board. And once we've heard from the health board that you have funding, we'll then refer you to Guy's. The whole process from about referral to ending to becoming pregnant, you should probably allow about 12 months. It's quite a lengthy process, and I don't know what COVID has done to that, if that's sped things up because there's fewer people applying, or if it's made things longer because obviously Guy's being in London would have been impacted by the lockdown as well. So I'm not sure what COVID's done to the time frame, but should probably allow about 12 months. So it's quite a lengthy process to go through. If you're using and you should use contraception whilst you're going through the process unless guys tell you any different, or tell you to change methods of contraception. I think that's probably everything and all the questions that all the things that I wanted to run through. I don't know if you've got any questions that have come through.
Siobhan, yes, we have some questions to work through here that we've received in advance of the session. I'm keeping an eye out on the chat there as well to see if anybody else has anything coming through. So we'll just keep a wee eye on that. But if we take you with the first one, so you mentioned a number of options at the start and then focused on the PGD. Is there any genetic counselling to talk through these various options in terms of, the ethical considerations or the impact on the family? Is there an opportunity to speak to yourselves about that?
Yes, when you're referred initially for the appointment to talk about, because you're interested in PGD, we will talk through sort of ethical considerations and things to think about before. And there are quite a few couples, the various conditions, not just Huntington's, that once they've thought about the ethics of it, they actually decide that, PGD is not for them, either ethically or just because it's just too stressful of a process to go through. So yes, there's definite options, and some couples go away and think about it and then come back to us again, say, yes, actually now we're interested, or never come back to us because they've decided it's not for them.
Okay. You mentioned as well from the point of referral to Guy's until potentially a pregnancy is happening. Well, you're talking about 12 months. Do you think it takes a wee bit longer for people in Northern Ireland by virtue of all the travelling back and forth and the appointment times and stuff than it would be for
No,
people in UK?
no, I don't think that. I don't think that makes a difference. You would when we make the referral to guys, the only what at our end is the waiting to see us, and then the applying to the Northern Ireland Health Board. Of course, that's to do with Northern Ireland. But once it's made, the referral has been made to guys, you would sit on the referral on their waiting list like anybody else, and where you come from doesn't make a difference to them. And then they will give appointments for you, and where you're from, it doesn't make a difference. The only thing would be is if you decide to slow it down yourself, or you're trying to do some things more locally and there's a bit of a hiccup of getting things done locally, but guys themselves won't treat you any differently because of where you're from. It won't slow it down from a guy's point of view.
Okay, great. And you mentioned that when you're actually pregnant, that your pregnancy would be treated as any other pregnancy. So if you were based in Northern Ireland and you had any issues, you could present to your doctor or your GP, and that they would treat you the same as any other patient who was pregnant.
Yes, because once you've become pregnant, then there's no difference now between you and anybody else. It's only the action of getting pregnant that is different.
And once you are pregnant, do you still have to go back to Guy's for any appointments?
No, once you're pregnant, that's it. You don't need to go back to Guy's again.
Great. So there's another question here. My mum has had HD. She's been showing signs for a while, but we only got her diagnosed last year. So she was an only child and no one knew about HD in the family. My husband, my husband's mum, my husband doesn't want to be tested, but we both want to start a family. So what options are there for us without him having to find out if he has HD?
Okay, that's a lot more complicated. It is possible, but it's a lot more complicated. And if that couple were to come to the genetics department, we would talk things through them and be able to show them diagrams, or make it a bit easier to understand if we can show diagrams and things. But so basically, it can be technically possible, but it's tricky. So what they would do then is guys would need a blood sample from both partners, so the husband and his wife. They would also need a blood sample from one of the husband's parents, ideally the person who's got Huntington's, so the husband's mother. And what they would then be doing is they would not be looking for the exact gene change that causes Huntington's. They would be looking for other markers on that chromosome, so it's chromosome 4. So they would be looking for other markers. So what they're trying to do is track the chromosome that's being passed down, rather than the actual Huntington's disease gene. Because when we have children, we have 2 copies of every gene, and our genes are on chromosomes. So we have 2 copies of every chromosome. And when you have children, you pass on half of your genetic material to your child. So the husband will have 1 copy of chromosome 4 from his mum and 1 copy from his father. The chromosome 4 from his mum is what we would call the high risk chromosome, the one that's 50% risk. And the one his father is fine. So what the lab would need to do is be able to make sure that they can determine the difference between the chromosome the husband got from his mother and the chromosome the husband got from his father. If they can't determine the difference without doing an actual genetic test, then PGD is not an option. But if they can determine the difference between those two, then the next step is the husband's partner's chromosomes. Can they tell the difference between those? And again, if they can't, PGD is not an option. But if they can, then what they would do is when they're looking at the embryos, they would be tracking the chromosome number 4, and they would only implant embryos that did not inherit the chromosome number 4 that came from the husband's mother. So it's ruling out a lot more embryos, and we could be going through the whole PGD process when the husband's not even at risk. But it can be possible, just provided that you're able to tell the differences of the chromosomes. I know that's quite hard to explain just over a video. If the couple came to us, we would be showing them diagrams, and I think it's probably a wee bit easier to understand when you see it in a diagram form. So is it possible? Yes, it is, but it's even trickier than the regular PGD.
Okay. And in those instances, if there were any issues, they would simply say that the embryo or the process hadn't worked, or the embryos weren't viable, or there was nothing suitable, rather than saying that all of the embryos had HD or...
Well, they wouldn't actually be testing for the HD expansion. So would know. So what they would then say is, they would either say, no, we can't tell the difference between the chromosomes, so therefore we can't even do the process.
Yeah.
Or they would then say, the embryos have inherited the high risk chromosome or the low risk chromosome, because they're not actually telling if the embryo has HD or not. They're specifically not testing that. So the husband doesn't need to worry that somebody knows his result and he doesn't. Nobody will know his result. They're not looking at the HD gene. They're just trying to track the chromosome through the different patterns on the chromosomes.
Okay. And a question has come in there. In that instance that you've described, what happened if the husband's mother, say, had already passed away and there was no way to get a blood sample from her?
Then the next step would be to go to the grandfather, so the husband's father, because if the chromosome didn't come from so he's got 2 copies of his chromosome. If it didn't come from the father, then it must have come from the mother.
Okay.
But if the mother's already passed away, we would need a confirmed Huntington's disease result in her, rather than just thinking that she had Huntington's. If we can't confirm she had Huntington's, we can't do the test.
Okay.
Because we might be doing PGD for a condition that's not actually Huntington's. So we would need a proven test that the mother had Huntington's, and then blood from the father. If both grandparents have passed away, we can't do it.
Yeah, it just becomes more difficult then. So you need a proven link to Huntington's disease. Okay. Yeah. Otherwise, the person would want to submit to testing.
Yeah.
Okay. My ex-partner had Huntington's disease and died by suicide 10 years ago. We had one child together who was 12. When can we find out if she will have HD?
Okay, we don't test children. Unless it's very rare circumstances where a child can have symptoms. That's unusual and that's different. That would be a diagnostic test. But assuming they're not concerned that the child is actually one of these rare ones that has symptoms, we would not do a predictive test on a child. The reason for that is everybody has to decide when or if the time is right for them to have predictive testing. And there are plenty of people that choose that decide that they never want to know and don't have testing, and that's that person's right. And if we were to test them as a child, we've taken away that right from them. And even if they decide they want to test, then they will choose the time when it's right for them. It may be that they only want testing when they're in a stable relationship rather than before that. Because if you have testing before you're in a committed relationship, then you always got at the back of your mind, when do I tell this person that I've got this gene? So some people choose not to do it until then. So we won't test a 12-year-old. They have to be an adult before we would test them.
Okay. You mentioned before that embryos that do have the Huntington's disease gene are left to perish. Mm-hmm. What happens then to fertilized embryos that don't have the Huntington's disease gene that haven't been implanted? So the good ones as such. Okay.
They're frozen,
yeah,
but they won't keep them forever. So you probably need to discuss with guys. And I think but you need to confirm it with them. I think at the moment they would keep them for 2 years for free. Mm-hmm. After that, you would start to get a bill, or you would need, and I don't know what that bill is. I don't know how much it is. Or you would need to make a decision what you're going to do with those embryos. Do you leave them to perish? Do you use them? Do you let other couples who are infertile use them? Do you? That's a decision that you would have to make and then discuss with guys.
I'm presuming then what you had said previously is if the female in the couple reaches 39 before the embryos are used, that they won't be implanted by guys because she'd be considered too old then at that stage.
That would probably need to be discussed with guys, because the tricky situation there is that embryo was fertilized before she reached 39, but of course now she is 39, so she may not respond to the medication that's needed to make her be able to accept a pregnancy. So if they were fertilized before, then you probably need to talk to guys, but there is a very distinct possibility that they would not be able to use them.
Okay. You touched on this slightly earlier, Siobhan, but just to go over it again. So if I get pregnant naturally, can you test to see if the baby has Huntington's disease? Do you want to answer that bit first?
Technically, yes, you can.
Okay. And is that a test that could be done in Northern Ireland, or would have to be over in the mainland UK somewhere?
We see so this is what the difference between technically you can, but would they? That's
Yeah.
two different issues. Because again, going back to before, if you're doing the testing, now you know you've taken away the child's right not to know.
Yeah.
So if you're going to do a test during a pregnancy, they would always want to know, well, what are you going to do with the information? Why are you testing? So with the case of Huntington's, to test, they wouldn't do the test just so that you could know what your child has. They would only be doing it if you were going to act upon the pregnancy, so end a pregnancy. And in Northern Ireland, that's hard because that baby is not going to pass away in childhood because of Huntington's.
Mm-hmm.
So it would be hard to get grounds for termination based on the effects on the baby. You can get grounds for termination based on the stress of the mother. But in that case, I don't know because we've only recently been allowed terminations in Northern Ireland. So I don't know if the obstetrician would do the test, would even do the amniocentesis, because they know that the result is going to stress the mother.
Yeah. So we need a wee bit of clarity on that then from
yes,
the obstetrics. Okay.
Yeah.
My family are very religious, and I'm wondering if churches support PGD. Do you know anything about that?
I don't, I'm afraid. I don't know. So I suggest you talk to your clergy person, and they would be able to tell you what their thoughts on the church. And even if, overall the church may say something, if your local group disagrees with it, then that couple may not want to go through with it because their local church they attend doesn't agree. So that's something you probably need to discuss with the clergy and amongst yourselves if you're prepared to go for that, even if the clergy don't agree. I actually don't know what they think on that.
And the next question here is, I had my son when I was 17. I didn't know that I was at risk of Huntington's disease at the time, but my dad has since been diagnosed. So I'm in a relationship and my partner and I would like to have a child together. Will the NHS pay for my fertility treatment to help me have a non-HD risk baby? I suppose what they're saying basically is that they have one child who's at risk and are asking if they would be eligible for PGD.
Okay, so it would depend on all the things that I'd mentioned before, the smoking status of both couples. Do they live together? Is the female is she 39 or is she under the age of 39? Is her BMI of a healthy weight? If the answers to all of those are that's fine, and she makes it into guys on the basis of that. So she has a child already. I'm assuming because the child is 17 that we don't know if the child actually has the gene or not. So that's an at-risk child. So it's not a child that we know for sure doesn't have it. Mm-hmm. Therefore, she could get PGD.
Okay. We've generally tended to talk about male-female couples. Are there any issues for same-sex couples accessing PGD, other than obviously the requirement for donor sperm or egg?
Yeah, so they've got the added complication of needing the donor sperm or egg, which they would, I think, would have to source themselves. I haven't had a same-sex couple come through for PGD, so I haven't looked into this, but I think you would obviously need the added thing of getting yourself a donor sperm or a donor egg, but technically the process is the same. You're just going to need the donor.
Okay. What if a person is early symptomatic with Huntington's disease, either the father or their mother, when they're seeking PGD treatment? Is that something that guys would take into account?
Yes, because whenever they do the testing, whenever they do the PGD, one of their things that they have to satisfy is the criteria for the welfare of the child. Mm-hmm. So they would need to make sure that the parent who is not showing symptoms is capable of and is fully both emotionally and physically capable of taking care of a young child as well as their partner who's going through HD. The symptoms of HD. So having earlier signs, I don't think would necessarily totally rule you out of going for PGD, but it is something that you need to carefully consider.
Okay. And if a couple here in Northern Ireland were successful for funding for the treatment, all of the back and forth trips from Northern Ireland to London, are they covered as well by the funding, or would people have out of pocket expenses?
Yeah. So flights are covered for those that need it. So that would be the couple themselves. If they have other children or any other family members, that is not covered. Has to be the only people who are covered are those that are essential for the treatment. So that's the couple themselves. If an overnight accommodation is needed, so for when they're doing the egg retrieval, the female is sedated, so it's recommended that she stays overnight because she can't use public transport. So that's an overnight accommodation would be paid for, but within reason. So that doesn't mean you're not going to get some swanky hotel at the Ritz or something. It's a basic accommodation. I know there's been issues in the past, not necessarily with Huntington's, but where we've queried why do they need to stay in a flat with several rooms, and they don't. You just need the hotel room. So they're going to cover, but they're covering basics. It's not a nice weekend away that you can take family with.
And things like meals and public transport and things like that would be covered as well, and your general sort of subsistence costs?
I don't know about subsistence costs. Travel, yes. To be honest, I don't know about the subsistence
Okay,
costs.
no worries. That's okay. And does that tend to be that people have to spend the money and then claim it back afterwards?
Well, because you can know ahead of time that you've got the appointment. So you would contact the travel office at the city hospital, and they will talk to you and then arrange flights and any needed accommodation. So no, you don't have to have that out of pocket. It's actually easier if you don't, because if you go and spend it yourself and then try to claim it back, it can be a bit trickier. It's just easier if you let them deal with it.
Yeah, it's just I think costs can be a barrier for people for here, just in terms of those real practicalities of it's okay if they're paying for it, but how can we afford to get over and back to London, 5 or 6 times and things like that, and childcare and all of the other considerations that might be there.
Yeah, so childcare wouldn't be covered. They wouldn't pay for your childcare, just the travel.
Yeah. One final question, Siobhan, before we let you go is once people have commenced the PGD journey, would they have access to the likes of yourselves for ongoing counselling or questions, or is it a case of once you're on and then you're on your own?
No, they can ask us for questions, but Guy's Hospital are the experts in PGD, and your very first appointment with Guy's is going through the PGD process in a lot more detail, and they'll have contact numbers for them as well. So if your question is quite specific sort of around PGD, Guy's are probably the better team once you've started the process, because they'll be able to tell you more specifically about your treatment and how they're treating you. So it's probably better for them, and you will have a point of contact for Guy's. But of course, we are available for questions as well. But just if it's specifically related to the treatment that Guy's are giving you, then they're perhaps the best people to ask.
And Siobhan, can I check? You mentioned that the Regional Fertility Service in Northern Ireland doesn't have any contracts with Guy's at the minute. But for people who are paying privately, do you know if they have any connections with private clinics in Northern Ireland at all?
I don't know, because I'm not aware of anybody paying private for PGD.
Okay, great.
But I'm hoping that the fertility thing should be sorted out. Dr. McKee, who's our lead in the department for general cases, he is trying to get the fertility to liaise with Guy, so they're actively working on it. It's just not in process at the moment.
Great. Thank you very much, Siobhan. That's fantastic. There's lots of information there. I'm going to put Hilary Knight on the spot just for a second. Sorry, Hilary, don't panic. Hilary's from Fertility NI, and she might just use the opportunity to just mention what services you guys have available that might be relevant to people here. Pass you over there, Hilary.
Thank you. My colleague Rachel, who's also on the call, and I work with Fertility Network here in Northern Ireland, and we support people throughout their fertility journey. So we can provide a lot of one-to-one support. We run some wellbeing programs. We're just about to launch a new mindfulness program, which we have funding for. But it's really an opportunity also to chat to others on a fertility journey. So we run Zoom chats, and normally we would have support groups meeting up. But of course, in COVID, we're all like everyone else on Zoom now. So we also have a fertility nurse. So if you're going through any sort of treatment, IVF is quite a roller coaster of experiences. So we can talk to you about the IVF process. You can contact our fertility nurse as well. And we would link in with other health professionals too. We can sometimes signpost you. We have good links with the fertility counselling service in Belfast. So if you were going through treatment with the Regional Fertility Clinic in Belfast, you would have access then to counselling sessions with the fertility counsellors. And that's a really great forum to be able to discuss the issues that you're going through that are on top of anybody going through IVF. We know that the Regional Fertility Clinic is quite delayed at the moment in terms of the fact that their treatments were all stopped and suspended. So wait times are quite long at the Regional Fertility Clinic at the moment, and that has pushed more people towards the private clinics. Because, you know, for those people who are getting a little bit older, IVF tends to become less successful. So if you are considering this process, I'd urge you to look at it before you reach the cut-off point of 39, because that is obviously over 35, fertility can dwindle a little. So it's better to consider this at an earlier stage. If you want to contact us at any stage, you can contact us through our web. I'll put my email into the web chat, into the Zoom chat, if you like. And if you have any issues and want to chat to us about having a little bit of more support along the way, that we encourage you to get in touch rather than leaving yourself feeling isolated along the way as well. Does that help at all? I don't know if
it's great. No, that's perfect, Hilary. So what we'll be doing now is we'll follow up with this the video to all the participants, and we'll include some links to the likes of the Regional Genetics Service where Siobhan's based, and to Hilary's service with Fertility Network NI, and also some information around Guy's Hospital as well, which they have a great handbook around PGD. And if anybody has questions after this that they want to get in touch with. Sorry, Hilary.
Sorry, just to mention one other point too. Eligibility criteria is slightly different in England to here. So I don't know if the treatment is going to be done under the criteria for Northern Ireland or for Guy's be the English criteria. They are slightly different. So for example, smoking doesn't come up on the radar for Northern Ireland, but obviously we would recommend people not to be smoking. But in terms of whether you have a child already, that's slightly different here. So I don't know which of the criteria would be taken into account.
Right, so we'll try and clarify that and send the information around to everybody. Thank you so much, everybody, for your time and for taking an interest in this session today. And as I said, I'll be following up with all the participants directly. And thanks a million to Siobhan Harding-Lester from the Regional Genetics Service for giving us all that information today. Okay, thank you, everybody.